So, this is the pathophysiology, no? Yan, exertion of force followed by intracranial hemorrhage and your facial nerve palsy. And that's more common. Ano yung OVD? Trial of operative vaginal delivery. Okay. So, sequential instrumentation, ang sinasabi ni ACOG, wag nang mag-sequential use of instruments. Decide whether you're going to use either vacuum or forceps. And if you are not, if mag-fail na yung isa, proceed to your cesarean delivery rather than doing sequential instrument application. Okay. So for forceps, these are the different types of forceps that you can use. Lang. Okay. So you can have your Simpsons. Which among these is used for the aftercoming head of the baby? Sumasagot ba sila?
Wait lang po. Piper.
Okay. What's the most commonly used forceps in our setting?
Simpson.
Although, your Keylance and your Tucker McLean can also be used mostly for rotational purposes. Okay. So, okay, now let's go to your vacuum extraction. Okay. Between forceps and vacuum, ang vacuum natin, kailangan mas medyo matanda na yung baby. So, 34 weeks and above. So, gusto ko lang malaman, hanggang anong age pwedeng gumamit ng forceps sa preterm babies? Anong sagot nila? Kung ang vacuum ay 34 weeks, ang forceps, parehas ba sila 34 weeks? Or older? Kailangan term ba pag forceps?
Wait lang po.
Sumasagot.
Isa pa lang sumagot. Term only.
Ay, hindi. Pwede siya hanggang 32 weeks si forceps. Yan. Okay. Hanggang 32. So, yun yung difference ng vacuum at saka forceps. Mas pwede mong gamitin ang forceps sa mas preterm as compared to your vacuum. Okay, and then for vacuum delivery, you have your fewer scalp lacerations if you use your soft cup versus your rigid cup. However, one study showed that, 4 lacerations, but in terms of formation of cephal hematoma and subgaleal hemorrhage, it's same for both the soft and rigid cup. Okay. Ito placement ng vacuum to be able for you, no? So basically, which of the following letters reflect the correct flexion point used for vacuum extraction? So the color coordinated larger circles reflect the actual cup placement of the respective flexion point. So A, B, C. So A yung blue, B yung pink, C yung yellow. So, anong sagot? Kasi kung tama yung pagka-flex ng ulo ng baby.
Most of them answered A.
Okay, that's the correct answer, letter A. So, you have to identify the flexion point, and it's usually 3 centimeters in front of the posterior fontanelle, and the center of the cup should be overlying the flexion point. And this placement promotes flexion, descent, and auto-rotation. If you want, with suction, with vacuum, traction can also be done, and this is directed from the point of fetal head flexed to the narrowest suboccipitobregmatic diameter, which is 9.5 cm. So this is now how you will do the technique. So basically, if you place the suction in this ideal position, no, your flexion point, then cup detachment is minimized. Okay, you also prevent twisting of the head, and it delivers the smallest head diameter. So ayaw naman, kasi kung hindi naka-flex yung ulo, napakahirap ilabas din yung ulo ng baby using vacuum delivery. So important here is the flexion point when we're talking about vacuum delivery. So see, parehas din lang naman, ano? Kapag tinitignan ninyo yung direction ng same as when you do your forceps delivery, down and up, okay, because it follows. So again here, if you're going to look at the clinical correlate, which is the direction of your vagina, that is actually how it is. And hindi ba kapag sinut nyo rin yung speculum, ganun din naman, hindi naman diretso yung pag-push ninyo ng blades ng speculum downwards and sloping upwards, ganun din yung pag-apply and pagkuha ng vacuum, or also your forceps. So just remember that these are the landmarks of your fetal skull. So it's the same whether you're going to do your forceps or your vacuum. Your requisites, no, hindi ko na sinama rito, but the requisites would be the same. So you're going to do your vacuum with parang same requisites as your outlet forceps extraction. Okay, so usually you use the largest cup that can be easily passed, and you introduce this sideways into the vagina by pressing it backwards against the perineum. Make sure that fully dilated, wala kang cervix, wala kang vaginal tissue na entrap between the cup and the head, no, wala ka ring umbilical cord, wala ka ring wala ka ring arm or limb, especially in complex presentation. Okay. So this one, ito dapat alam niyo na yung sagot dito kasi nabanggit ko na yan kanina. Which would here be a contraindicated for your vacuum extraction? Except.
Most of them answered C.
Okay. So 30 weeks, you have fetal thrombocytopenia, you cannot assess the fetal head position, and these are actually the same contraindications for your forceps as well. But occipital-transverse presentation, because you can also use your instrument to rotate, pwede pa rin. Okay, so these are the contraindications, ha? Okay, operator inexperience, suspicion of CPD, inability to assess fetal position, phase and other non-vertex presentation. If you have recent fetal scalp blood sampling, kasi pwede mag-coagulopathy ka pa rin, pwede ka mag-bleed, and a high station. Okay, what would be the advantages of vacuum over forceps? Okay, so in most cases, between forceps and vacuum, regional anesthesia can be foregone. Pwedeng hindi ka mag-regional anesthesia. You use less compression force. Okay, so I think baka itong mga pwede nilang tanungin, just in case, yung compression force, alam mo yung mga mahilig sa numbers. So kung ito ay ang vacuum natin ay 0.77 kg per centimeter squared versus 1.3 kg per centimeter squared force for your forceps. Okay, and it can be applied on non-engaged head, and pwede rin, hindi full cervical dilatation pero nakakatakot, pero siguro so basta ang isang rule ay pwede, you are amenable to abandon the operative vaginal delivery procedures. Pwedeng trial din lang. Pag hindi kakayanin, better be safe than sorry, proceed to cesarean section. Okay. So here are the differences between your forceps delivery and your vacuum delivery. So, yan. Summary na lang yan. Okay, success rate, your forceps would probably give you a slightly higher, but again, I think it will all boil down to operator expertise. Some obstetricians are more adept at doing vacuum delivery. Mas gusto nila yon, fine. Then, mas mataas ang kanilang success rate with forceps. So, basically, yan. While your traction force would really be for forceps, it's operator control versus the as compared to your vacuum, which is limited by your vacuum pressure. Yan. So, duration of use usually short. Once ma-apply mo ng tama sa forceps, delivery is quick, while your vacuum, pwede ka pa rin medyo mag several attempts bago ka either maging successful or mag-abandon. Yan. Okay, so question. Ano ba itong question natin? In order to facilitate delivery, operative vaginal delivery involves application of forceps or a vacuum extractor to the fetal head. Which of the following is not considered an indication? A, B, C, or D? Or now on the tail end, tama. Nila. Anong sagot?
Wala pa po. Wait.
Uy, question ito. Nakakala nila text pa rin lang.
Waiting lang.
Not considered an indication for operative vaginal delivery.
Most of them answered A. Some are D.
A siya, kasi di ba, with EPID, dapat 3 hours. 2 plus 1. Di ba? Ay, 4 hours pa nga eh. Oh, 3 hours without a regional anesthesia. Okay? Yung ano lang natin to, yung description lang natin ng ano yung prolonged second stage. Okay. So ito, device choice for use in operative vaginal delivery depends on which of the following. A, B, C, or D? Fetal orientation, maternal pelvic, position of the fetal head. D, user preference.
All of them answered dog.
Okay, user preference. 37-year-old G3P2, 41 and 1, second stage with epidural, pushing for 2 hours with fetal head at +3 in a persistent occiput posterior. You are considering operative vaginal delivery. Her BMI is 42. And she had prior shoulder dystocia with neonatal brachial plexus. What is the most appropriate management? A, attempt vacuum-assisted delivery with appropriate cup placement. B, proceed with rotational forceps-assisted vaginal delivery. C, proceed with CS. D, use manual rotation followed by vacuum extraction.
Most of them answered cat.
Okay, very good. O, dapat alam nyo na, ha? Alam nyo na. Naku, nag-dystocia na nga siya dati. Meron pa siyang neonatal morbidity, tapos isa-subject nyo pa siya sa possibility na naman ng morbidities. ECS na yan. Okay. Ito. In a vacuum-assisted vaginal delivery, which of the following factors is most predictive of neonatal subgaleal hemorrhage and poor outcome? Which of the following factors is most predictive of neonatal subgaleal hemorrhage and poor outcome? A, vacuum use in preterm deliveries below 36 weeks. B, combined use of vacuum and forceps during single delivery attempt. C, more than 3 cup detachments with increasing traction force. D. Delivery time more than 20 minutes from cup placement to expulsion. A, B, C, or D?
Mix of A and C.
It's actually C. C. Okay, kapag ka nagpa-pop off, most probably magfe-fail yan. So, ano na, abandon ship na kayo dyan. Okay? Pwedeng may risk ng trauma, but cut detachment is the more direct predictor of subgaleal bleeding. Okay. Next, during unattempted vacuum-assisted delivery, you encounter significant fetal caput formation and increasing difficulty in identifying fetal structures and fontanelles. Which diagnostic adjunct is recommended to accurately confirm fetal head position before proceeding? A, B, C, or D? A, handheld Doppler ultrasound. B, transabdominal ultrasound. C, digital rectal examination. D, transperineal ultrasound. Isagot na.
Dalawa eh. Half yung C and D. Cat and dog.
Pero dalawa lang sila. Tig-isa silang sagot.
Hindi. Alternate eh. Though ngayon, mas marami na yung dog.
Ayan, transperineal ultrasound. Okay, superior to digital examination. Although hindi natin, pero ngayon kasi, di ba, parang mas madalas na nandyan naman yung may ultrasound machine na tayo sa DR mismo. Di ba? So, it is now known to be more superior for assessing fetal head position and station, especially when caput and molding distorts landmark. Okay? Which of the following, corny naman itong question na to, but yes. Okay. Is not a function of obstetric forceps during operative vaginal delivery? A, B, C, or D? Oy, sagot. Dapat marami na sumasagot nito.
All of them answered dog.
Okay. Obvious naman. Ito, ano ba ito? Last na ba ito? Ang dami kong question. Parang 4 pa. Ito. During a difficult second stage labor, a decision is made for forceps-assisted delivery. You identify moderate caput succedinarium. Pero nasagot na rin natin to. Which is the most appropriate pre-delivery action to maximize success and reduce complications? A, B, C, or D?
All of them answered cat.
Ano ba yun? Okay. Absolutely contraindicates the use of vacuum-assisted vaginal delivery. According to alarm, ha? And testmanship na lang. A, fetal weight. B, incomplete cervical dilatation. Although sabi natin kanina. Pero sa alarm kasi, anong sabi nila? Di ba sabi ko, yan, forceps at saka vacuum, parehas halos ng mga contraindications. Anong sagot?
Most of them answered boy.
Okay. Yan. Okay na. That's the last for this. Okay, that's it for our operative vaginal delivery. Okay, so with that, for the first